Hey everybody, thanks for joining us again for TouchCare Talks. This week I'm excited to have Julia Paphitis here with us from Cancer Expert Now. Julia, you want to give us a quick intro on Cancer Expert Now and what you guys do?
Absolutely. Thanks so much for having me, Rob. It's really great to be here and with your great team at TouchCare. What we do at Cancer Expert Now is we really provide expert second opinions for your solution MD opinions. We're really the engine that helps drive that clinical piece, that robust clinical piece that really is the extension of advocacy and what you do here at TouchCare.
Yeah, that's awesome. And we've had a great experience working with you guys and your team. Explain to us why that second opinion is such an important aspect or tool for employees who are going through a medical situation or members in general.
Sure, absolutely. Well, it's a difficult time when an employee gets a diagnosis, not only for the employee and their family, but for the employer as well. And oftentimes, in any sort of environment, the employer is really taking on a disproportionate burden, more so than the employee oftentimes has to financially. So we help not only with that navigation of the clinical piece and really providing those top tier expert opinions, but really the entire continuum of care. So really that extension of advocacy where we can help people, especially when they're going through serious issues, whether it might be a complex condition or even cancer. We can help financially, social, emotionally, bring them to different types of therapies. And oftentimes when you are in a second opinion type environment, what we find more times than not is cost savings actually is the result of it. Not only does the member have a better experience with their care plan and treatment, but typically cost savings does come as a result. Oftentimes it's because we are finding some sort of misdiagnosis or misstaging, which really helps our clinicians recommend better treatment paths. And then they work in collaboration with the treating physician to really make sure that that member's on the right path for treatment, oftentimes saving not only procedures, but different types of medications, so really helping the plan all around from claims to PBM costs.
And I think that's a really important distinction even from a typical second opinion program. And one of the reasons why we partner with you guys so much is because your clinical staff stays with the member through the entire medical journey, right? And is collaborating with that member's physician to determine what ultimately is the best path, and maybe on the path that they're already going down, right?
Absolutely. And I think that really is the success behind what we do and what we do alongside TouchCare as well, is really staying with that member, holding their hand, really collaborating with that treating physician. Sometimes it's an oncologist. And our clinicians are really the top tier. They are leaders of staff, leaders of research. The clinicians that other doctors, other oncologists are really looking for guidance and direction and advice from. And so when we can provide those opinions, they are not just any second opinion, they are really a definitive opinion. The other clinicians are very happy to work alongside with our clinicians as well, because they are someone that maybe this oncologist would have liked to have the opportunity to call or interact with for this particular patient.
Interesting. Yeah, it seems like a win-win-win all around in that sense, right? The member wins with the expert guidance from two physicians. The employer's winning on a potential reduced cost, as well as the member for that matter. And potentially the doctor's winning by having that expert second opinion involved throughout.
Absolutely.
And it seems like, sorry.
Absolutely.
Yeah. And it seems like even if you're not able to change a clinical outcome or a direction in terms of the care that the member is going down, there's got to be a peace of mind that there's some value for that member and really for the employer in terms of productivity and things like that as well, right?
Absolutely. There's an enormous peace of mind. And I will tell you, and our founders will tell you, our CEO went through this with his own father. He went through cancer. Our other founder, our co-founder, Dr. Sanjeev Agarwala, is a leading oncologist and hematologist and expert in his field. And then our president is Dr. Charles Balch, who is the former ASCO president. And the issue that persists in medicine, and we have wonderful people working with patients in the medical community. But the big issue that exists is there's so much information. There are 5,000 journal articles that are published every month, and the information is just not able to get diffused to everyone. So the best and right care and right treatment protocols can get to everyone. And so that's really what's happening at Cancer Expert now and MD Opinions, is that rapid diffusion of information and the democratization of access for everyone. And so when you look at what that does for the patient, it really provides them and the employee with that peace of mind that is invaluable. It's like having an expert doctor in your family that you can go to for all of these questions and all of these things to guide you and stay with you throughout your experience in the care community.
Yeah, you can't put a price tag on that peace of mind, right?
You really can't.
So.
No.
Well, really enjoyed having you on, and
so
great,
much.
Great to have you in from Chicago for the day. So glad we caught you, and
Great to be here.
really appreciate you coming on. So
Well, thank you. Thanks for your time.
Yeah.
Pleasure.